Hey everyone, welcome back to Unmasked Insights. Today, we're diving into an important topic that affects many people but is often misunderstood: the signs of mental health issues. Knowing these signs can help you or someone you care about get the support they need. So, let's get started. Mental health is just as crucial as physical health, but sometimes it can be tricky to recognize when someone, or even yourself, might be struggling. It's not always obvious, like a broken leg. It's more subtle, happening beneath the surface. But let me tell you, it's just as real and just as important to address. Here are some key signs that mental health issues might be at play. First up, persistent feelings of sadness or hopelessness. Look, we all have our down days, right? But we're not talking about a bad day here, we're talking about a pattern. If someone is feeling down most of the time and these feelings don't seem to lift, it could be a sign of depression. This might look like a constant feeling of emptiness or a sense of hopelessness about the future. They might say things like, "What's the point?" or "Nothing ever goes my way." They've lost that spark, that drive that used to motivate them. This isn't just being a Debbie Downer. This is a deeper issue. Now, sadness in itself isn't a bad thing. It's a normal human emotion. But when it starts to take over your life, when it's there day in and day out for weeks on end, that's when you know it's time to take it seriously. It's like a rain cloud that's been hanging over their head for weeks, and they just can't seem to shake it off. They might withdraw from friends and family, lose interest in hobbies they used to love, and even struggle to get out of bed in the morning. This is not something you can just snap out of. It's not about willpower, it's about brain chemistry. And just like you'd see a doctor for a physical ailment, you need to address mental health issues with the same level of seriousness. Remember, recognizing the signs is the first step to getting help, and getting help is the key to feeling better and getting back to living a full and meaningful life. Next, let's talk about excessive worry or anxiety. Now, a little anxiety is normal, even healthy. It keeps us on our toes. But we're talking about anxiety that's out of control, anxiety that's running the show. If someone is experiencing overwhelming feelings of anxiety, fear, or nervousness, even in situations that don't seem to warrant such a response, it could indicate an anxiety disorder. This might include persistent worry about everyday activities or panic attacks. They might feel like they're constantly on edge, like something bad is about to happen. They might have trouble sleeping, difficulty concentrating, or even physical symptoms like a racing heart, sweating, or shortness of breath. It's like their internal alarm system is stuck on high alert and they can't seem to turn it off. This kind of chronic anxiety can be incredibly debilitating. It can interfere with their work, their relationships, and their overall quality of life. Now, many people try to mask their anxiety to pretend everything is fine. But you know what? That just lets it fester and grow stronger. We need to break down the stigma around mental health, folks. It's okay to not be okay. If you see someone constantly worrying, overthinking every little thing, or avoiding situations that make them anxious, it's time to have a conversation. Let them know you're there for them, that you care, and that there's no shame in seeking help. Remember, anxiety is a real medical condition, and it's treatable. With the right support and treatment, people can learn to manage their anxiety and live full, happy lives. So, let's break the silence and start talking about mental health. Let's talk about sleep, or more specifically, changes in sleep patterns. When your sleep is out of whack, it throws everything else off balance. It can be a major red flag for mental health issues. Insomnia, where you're staring at the ceiling at 3 a.m., your mind racing and oversleeping, where you can't drag yourself out of bed. Consistently struggling to fall asleep, stay asleep, or sleeping way more than usual, it's time to pay attention. It could be a sign of depression, anxiety, or other mental health concerns. There are effective treatments for sleep disorders. Good sleep is essential for our well-being. Now, let's talk about a sign that can be particularly heartbreaking to witness: withdrawal from social activities. You see, humans are social creatures. We thrive on connection, on spending time with loved ones, on sharing experiences. So, when someone who used to be the life of the party suddenly starts avoiding social situations, it's a big deal. It's like they're slowly disappearing into themselves, and that's a sign that something is wrong. Maybe they're canceling plans at the last minute, always coming up with excuses. Or they're just not as chatty, not as engaged as they used to be. They might even stop returning phone calls or texts. This withdrawal can be a sign of depression, social anxiety, or other mental health challenges. They might be struggling with feelings of worthlessness, self-doubt, or fear of judgment. It's important to remember that this withdrawal isn't a personal rejection of you. It's not that they don't care about you or value your friendship, it's that they're struggling, and they need your support more than ever. Now, I know it can be tough to watch someone you care about isolate themselves, but don't give up on them. Reach out, let them know you're there for them, even if they push you away at first. Encourage them to talk to someone about what they're going through. A therapist can provide a safe and confidential space for them to open up and work through their feelings. Chapter 5: Changes in Eating Habits. You know, we often think of food as just fuel for our bodies, but it's so much more than that. Our relationship with food is complex. It's tied to our emotions, our self-esteem, our mental well-being. So when someone's eating habits change drastically, it's a major red flag that something's not right. We're not talking about indulging in a little extra dessert now and then. We're talking about significant changes in appetite, like sudden weight loss or gain, or developing an unhealthy obsession with food and calories. Maybe they're skipping meals altogether, or they're constantly restricting their food intake, counting every calorie. Or perhaps they're binge eating, feeling out of control around food, and then consumed by guilt and shame afterwards. These changes in eating habits can be a sign of depression, anxiety, eating disorders, or other mental health issues. They might be using food as a way to cope with difficult emotions, to numb out, or to punish themselves. Now, it's important to approach this topic with sensitivity and compassion. It's not about judging someone's weight or their food choices. It's about recognizing that their relationship with food has become unhealthy and that they need help. If you notice a loved one's eating habits have changed dramatically, don't ignore it. Start a conversation, express your concern, and encourage them to seek professional help. Chapter 6: Difficulty Concentrating. Let's talk about focus, or rather, the lack thereof. You see, our minds are incredible instruments, but when they're clouded by stress, worry, or mental health challenges, it can be tough to think straight. We're talking about difficulty concentrating, making decisions, or remembering things. It's like their brain is stuck in a fog and they just can't seem to clear it. Maybe they're struggling to follow conversations, constantly zoning out, or forgetting appointments. They might make careless mistakes at work or school, or find it impossible to stick with tasks they used to handle with ease. This difficulty concentrating can be incredibly frustrating and disheartening. It can make them feel inadequate, like they're losing their grip. And the truth is, it's often a sign that something deeper is going on. Mental health issues like depression, anxiety, and ADHD can all impact our ability to focus and think clearly. It's like trying to run a marathon with a backpack full of rocks. If you notice a loved one is struggling with concentration or memory problems, encourage them to talk to a professional. There are effective treatments available, and addressing any underlying mental health issues can make a world of difference. Chapter 7: Increased Substance Use. Now, this next sign is one that often raises alarm bells, and for good reason: increased substance use. You see, when someone is struggling with their mental health, it's all too easy to turn to drugs or alcohol as a way to cope, to numb the pain, to escape from reality. But here's the thing: substance abuse doesn't fix the problem. It only masks it for a little while, and in the long run, it only makes things worse. We're talking about changes in drinking habits, like drinking more often, drinking larger amounts, or having trouble controlling their alcohol intake. Or it could be an increased reliance on drugs, whether it's prescription medications or illegal substances. Now, it's important to remember that addiction is a disease, not a moral failing. People who are struggling with substance abuse need our compassion and support, not our judgment. If you're concerned about a loved one's substance use, don't wait to intervene. Talk to them, express your concerns, and encourage them to seek professional help. There are effective treatments available, and recovery is possible. Remember, addressing both the substance abuse and any underlying mental health issues is crucial for long-term healing and well-being. If you or someone you know is showing these signs, it's important to seek help. Talking to a mental health professional can provide support and guidance. And remember, mental health is just as important as physical health. There's no shame in reaching out. Cut to host smiling. Thanks for watching. If you found this video helpful, please give it a thumbs up, share it with friends and family, and don't forget to subscribe for more content on mental health and well-being. And as always, leave your questions and thoughts in the comments below. Take care and see you next time. Outro music fades in.